My name is Dwan Kelsey, and I'm a nurse practitioner with Well Life, a diabetes clinic and educational resource center located in Raleigh, North Carolina. And we want to talk today about prevention in type 1 diabetes. There's a Finnish study in Finland that just came out with a hypothesis that states that we can prevent type 1 diabetes. And what they did is they looked at infants that were getting formula, infant formula. And with that, they followed these infants up until a certain age. And those that received formula developed type 1 diabetes. Type 1 diabetes is when the pancreas does not produce any insulin, and that's what separates type 1 diabetes from type 2 diabetes. We know that type 1 diabetes typically occurs in the younger population, so your children are the ones that we see. However, we do see a lot of adults now that develop type 1 diabetes. When we talk about exercise and the reversal of diabetes, and also in the prevention and management of diabetes, you want to exercise about 30 minutes. And I always say you want to exercise every day. It needs to be a routine daily event. Oftentimes I have patients that say, I want to exercise on Monday, Wednesday, and Friday. But when you tell the brain that, then more than likely that person is going to exercise 1 to 2 times out of the week, which we can't have. So our goal is to have them to exercise at least 5 to 7 times a week. Foods really have an impact on our blood sugar just naturally. And we have to remember that everything we eat turns into sugar except for meats and protein. So everything we eat, from a sweet potato pie to a pot of spinach, turns into sugar because our body needs glucose for energy. So when that happens, when our body turns all of that into sugar and utilizing the sugar, it's going to raise the blood sugar. So that depends on what we are eating. It depends on our diet. So diet is a huge factor when it comes to normalizing blood sugar. Diabetes is a very complex disease. This has just been basic information regarding diabetes. Please be sure to visit your medical provider for more information or for diagnosis of diabetes.